Hi, Mark.
Hey.
Do you have a minute to go with us and observe one of Anna's patients?
Yeah, sure. What will we be doing?
Well, there are a lot of secretions on the tracheostomy site dressing. The nursing care plan calls for site care once per shift, but he needs it now.
Okay.
All right, let's gather our supplies and go.
Let's do it.
Hi, Mr. Malone. How are you? This is Mark, a nursing student, and this is my instructor, Miss Swinson.
How are you?
It's okay if they observe? Okay, Mark was going to help me with cleaning your tracheostomy site. I'd like to do that now, if it's okay with you. All right. I was talking to your wife outside. She said that you're hoping to get back on the boat this summer. Good. Just check your ID bin. Okay.
Okay, Mark, for Mr. Malone, why are we doing this procedure?
Well, Mr. Malone, it's important to clean the tracheostomy and the skin around it to help prevent any infection. And it will also help you to breathe more easily.
Okay, so get set up here. I'm going to pour 1/2 inch of sterile normal saline into one basin. And the other basin, I'm going to pour 1/2 inch of hydrogen peroxide.
Okay. And now you can put on your clean gloves.
Okay. And now I remove the dressing and discard it. Okay, so move this. Okay, and then I assess the tracheostomy site.
All right. What is Anna looking for?
Any signs of inflammation or maceration or any infection.
And if the patient is sutured, you want to make sure the sutures are intact.
Right.
It looks good.
Then, stabilize the outer cannula and the base plate of the tracheostomy with one hand. Then you rotate the lock on the inner cannula in a counterclockwise motion with your other hand to release it from the outer cannula.
Okay.
Now continue to hold the faceplate and gently remove the inner cannula.
Now I take off my gloves. I'm going to put on the sterile gloves. Now let me just put this pad across your chest here. Okay. Okay, so now I pick up the inner cannula from the soaking peroxide, and I moisten the brush in the normal saline and insert it into the tube. Okay.
You're going to want to use a back and forth motion to loosen and remove any of the secretions that have accumulated in the inner cannula. And agitate the cannula and the saline to rinse off the peroxide.
Okay.
And what's next, Anna?
What is next?
You're going to remove the cannula from the solution. Tap it against the inner surface of the basin to shake off the moisture. There you go. Be sure to stabilize the outer cannula and the base plate of the tracheostomy with one hand. Then replace the inner cannula into the outer cannula and turn it clockwise so you can lock it into place. And make sure the inner cannula is secured.
Okay.
Then reattach the oxygen supply back to the tracheostomy.
Okay. You okay? All right. Okay.
Okay.
Okay, now for cleaning around the tracheostomy site, I pour the saline into the remaining basin. And I start off with this cotton tip applicator. I moisten it in the normal saline, clean around the stoma, and then I repeat it underneath the faceplate.
Right. And remember that each applicator should be used only once, and you're going to work in a circular motion to clean from the stoma site outward.
Let me just take this off. Okay. Excuse me here. Okay. And now I pat dry gently with the gauze. And then I replace the tracheostomy dressing with this one and slide it underneath the faceplate.
Exactly. Now, Mark, if we didn't have a commercially prepared dressing, what would we do?
She would fold a gauze dressing to fit around the stoma.
Exactly. But remember not to cut the gauze to use around a tracheostomy because it can cause loose fibers.
Okay.
Oh, yeah, and the loose fibers can get lodged into the stoma and could cause infection or irritation.
Exactly. They also could be inhaled into the trachea and cause respiratory distress.
Okay. So now I leave the soil tapes in place until I apply new ones. How long should this tape be?
Basically, it should be twice the circumference of the neck plus 4 inches.
Okay.
And of course, you see the ends are trimmed on the diagonal, which makes it easier to insert them into the openings of the faceplate.
Okay. All right. So now I insert this tape through the opening of the faceplate alongside the old tape. Okay, so I pull it all the way through until both ends are even.
Right. Next, you're going to slide both tapes under the patient's neck and insert one through the remaining opening on the other side of the faceplate.
Okay. Can you flex your neck? That's good. Okay.
Pull the tape snugly and tie the ends using a double square knot. Now the tape should be loose enough so that you can fit one finger between the neck and the ties.
Okay. Let me check.
That looks good.
It's okay?
Looks great. And then once the new ties are secured, you can carefully remove the old ones.
Okay. Okay, so now I'll just snip those. And then I cut the old one. Okay, all set here.
All right, let's put his oxygen back on, Anna.
Okay. Are you feeling comfortable? All right, I'll be sure and document the procedure.
Okay, it looks like everything's under control. Thank you, Mr. Malone. Good job, Anna.
Thank you.
Mark, you can come with me.
Have a good day, sir.
I'm going to get you back into a comfortable position. Let the bed down and your head down. Is that okay?